This is a public service announcement about anxiety awareness among college students. Anxiety is one of the most common mental disorders that goes unrecognized and undiagnosed every year. The American Psychological Association defines anxiety as an emotion characterized by feelings of tension, worried thoughts, and physical changes like increased blood pressure. As listed by the Anxiety and Depression Association of America, common symptoms of anxiety disorder include having constant worry, avoidance of common interactions, irrational fear of non-threatening situations, recurring panic attacks and nightmares, and repetitive actions. The two subfactors relevant to stress-induced academic issues are dorm life and multiple teaching styles. With dorm life, peer pressure from roommates can introduce competition to get better grades. This can be explained by students staying up to study during an exam week, which can evidently take a mental toll. As for teaching, one could think multiple syllabi are reasonable. However, when every teacher is implementing different grading scales, a stress of maintenance starts to develop. To specify, the plus and minus system at colleges can create a sense of panic among students as it can hurt their GPA. Social anxiety is the fear of interacting with individuals in certain social situations. This can easily become an issue for college students as they are exposed to an environment where they are surrounded by multitudes of students coming from all over the world. In the US, 15 million American adults have social anxiety disorders, where the typical age of onset is 13 years old. Although anxiety disorders are highly treatable, only 1/3 of those suffering receive treatment. Among students, social anxiety creates the inability to ask questions and interact with peers, maintain focus when in class, present information in front of class, and participate in extracurricular activities. Medications are usually one of the most popular steps most people take when treating anxiety. Selective reputable inhibitors and serotonin norepinephrine reuptake inhibitors are the most common types of medications. Some treatment options include therapy, which is a fundamental step in seeking to cope with anxiety and stress. For those with severe anxiety disorders and can afford it, therapy is highly recommended. Cognitive behavioral therapy is a common therapeutic technique that may help reduce anxiety. In addition, counseling and support groups can be an outlet for some students, allowing them to express their anxiety to professionals. Some USF campus resources available include the Student Wellness Center and the Counseling Center. Of course, if the stress or anxiety leads to suicidal tendencies or thoughts, please keep in mind the number for the National Suicide Prevention Hotline.